欢迎大家收。
Welcome to today's press briefing. We have two speakers. They are from the CHP, Head of Communicable Disease Branch, Dr. Chang Shuk Kwan, and from the Hospital Authority Chief Manager, Dr. Lau Ka-hin. We'll first hear from Dr. Chuang. There are 92 cases from yesterday that are tested positive. From 14112 to 14203, 12 cases are imported cases and 80 cases are local infections. Of them, 11 cases are L452R. Most of them are picked up from tests from quarantine centers of residents in Cheung Po House and also from Meng Lai House. And there are also 62 cases that are Omicron cases and 7 cases that are currently unclassified because of other reasons as well as a low viral load. Of the 67 cases, there are some that are related to other cases. 13 cases are currently unlinked. Of the 67 cases, there is one case that was a staff member of a pet shop in Tai Po industrial estate. The person went to a quarantine center on the 19th of January. There was a negative test result on the 24th, and the person was sent to quarantine center on the 27th and is positive on the 30th of January. It's now confirmed by CHP that it's a positive case with a low CT, with a high CT value. Well, we see that there might be antibodies, so it's a case that there might be previous infection cases. From the related cases, we have seen some vertical horizontal transmission. There are a number of units involved. We have worked together with the Architectural Services, the Housing Department, as well as the Environmental Protection Department to investigate. There is Ho Tim House in Chi Hong Estate, Unit 06. There are 2 cases of the same flat on 2 consecutive floors. Well, there is one floor that is a higher floor, 4 cases, and a lower floor, 1 case. So those living between the first and the 6th floor will have to be evacuated. And there is On Kwai House in Kwai Fuk Estate, Unit 08. Previously there were 208 units, and now there is an additional 08 unit on higher floors. So all 08 units from the 1st to the 40th floor will have to be evacuated. Kwai Yan House in Kwai Fong Estate, 14th floor. There are some units 03, 06 and 07 on the same floor. So for units 1 to 12 on the 14th floor will have to be evacuated. For 06 unit, we need to look into it. Well, we have looked into it. So above the 14th floor, those living in Unit 06 will have to be evacuated. Meng Lai House, Choi Wan Estate Phase 2, Unit 05. There are 4 units that have been affected. Also on the 10th floor, there is 105 unit. 3 units have been affected. So for Meng Lai House, 24th floor, 1514 units. They share drainage pipes, so they have to be evacuated. Units 13 to 17 on the 10th floor will have to be evacuated as well. Tai Wo Estate, Choi Wo House, Unit 25 and 26. For 25, 2 units. 26, 3 units. We're now carrying out site investigation. After that, we'll decide which units are affected will have to be evacuated. And the Methodist school in Sha Tin, As I mentioned yesterday, there are some staff members that are confirmed. There are 4 confirmed cases and 1 preliminary positive cases. The 12 people who work together will have to be sent to the quarantine center. In Tuen Mun, there is a Bank of China branch at there is 2 confirmed cases and 1 preliminary positive case. They know one another and they had shared a meal together. Apart from these cases and related cases, there are 13 currently unlinked cases. 2 are suspected Delta L452R variant cases. There is 1 45-year-old person working in a kitchen in Lok Fu Plaza, Yayatong. That person lives in Choi Wan Estate, Phase 2 Yuk Yu House. He doesn't leave the kitchen. Is a suspected Delta. The other one is Choi Fung Court. A 69-year-old retired person, also suspected Delta case. For the other 11 cases, 10 of them are suspected Omicron cases. There is 1 currently unclassified. Of the 11 cases, there is 1 living in Shek Wa House, Shek Lei Estate 2, working in Runway 3 for a contractor. That person's in charge of fire services installation services under a contract. There are about 20 people also working together. Contract number is 3033. The other persons who work at the same site, even though they are not from the same company, they will have to get tested under the compulsory testing notice. There are 2 other confirmed cases and 1 preliminary positive case working at the same location. There is 1 living in Chong Kwan O, Polam Estate, Po Ming House. Well, the person works in a restaurant in the Bowling Green Club. There is also 1 who lives in Flora Plaza, Block 8 in Fan Ling. It's currently unlinked case. There is also a 50-year-old female. The registered address is Sham Shui Po. We failed to identify any source at the moment. There is a 9-year-old living in To Kwa Wan Road. Block P. There is also Block 1 live in Block P, Chun Wan, Luk Yau San Chun, housewife. And there is also someone living in Kwai Fong House, Kwai Chung Estate, in working as a cleaner in Kwai Chung Sports Center. There is 1 living in Chong Ming House, Fan Ling. That person did not go to work after the 8th of January. There is also 1 who lives in North Point, Harbor Glory, a housewife. And there is also 1 living in Ming Fung, Long Fung Court in Ming Fung Court. There are 95 preliminary positive cases, including 1 who works as a residential care home for Sing Kong Bui. Lives in, he also works in Fong Yam House, so the residents at that home may have to be evacuated. For Hakka cuisine, we have obtained some environmental sample. There are 3 tables, previously 2, and now we've identified another table who visited there on the 17th of January. We obtained some environmental samples from the ventilation point on the upper floor. We have found a positive result. This is a Delta case. It seems that for COVID, the airborne situation is quite serious.
Dr. Lau will give you an update of the hospital authority situation. Good afternoon. As of 9 a.m. this morning, over the past 24 hours, 113 cases were reported to the hospital authority. Over the past 24 hours, 28 patients were discharged upon recovery. So far, 12,780 patients have been discharged, and 1,031 patients are now receiving treatment respectively in the Hong Kong Infection Control Center of Hong Kong, Northland Town Hospital, the Infectious Control Center of the Hospital Authority, the Asia World Exposed Community Treatment Center, and 13 public hospitals. All are in stable condition. I'd like to report 2 incidents. First, in relation to a preliminary positive case found at the General Outpatient Clinic at North Kwai Chung GOPC. A nurse working at this clinic received a rapid antigen test yesterday, a regular testing, and she tested positive. We've arranged for this nurse to be isolated at Princess Margaret Hospital, and further PCR test was conducted, and she tested positive on a preliminary basis. She's now in stable condition. On the 28th of January, Friday, that was the day she last worked, she received patients and explained the relevant procedures to patients, but she did not come into contact with any patient during her work. The hospital authority conducted contact tracing, and 1 operation assistant has been listed as a close contact, and this assistant will be put under observation. This assistant had a short conversation with the nurse who tested positive at the pantry. At the time, neither of them was wearing a mask. The rapid test results show that this assistant's result is negative, and we arranged for a PCR test to confirm the result. The nurse had donned proper personal protective gear in her duties, and no other patients or staff has been listed as close contact. North Kwai Chung GOPC has been thoroughly cleansed and disinfected, and we will continue to closely monitor the health condition of this staff member. Another incident regarding the negative pressure ward at Caritas Medical Center. The isolation ward of Wai Shan House of CMC had a power outage this morning at 11:41, leading to an incident involving the negative pressure ward. 5 COVID patients were at that time in the ward. The staff conducted emergency repair, and then the operation of the ward resumed normal at 12:04. At that time, all staffers proper personal protection equipment and N95 mask, and no high-risk procedure was being carried out, and the doors to all the negative pressure wards remained closed. According to the infection control team of the hospital's assessment, there is low risk of transmission. The floor is now open. Please use the mic when you ask questions, and please introduce the media organization you represent before you put your question. I'm from Now TV. Good afternoon. I'd like to ask for the details of a number of cases. First, about the person reportedly homeless in Sham Shui Po. Is he or she a street sleeper? If that is the case, well, does this case mention where they frequent the streets and areas involved, and about the staff working at the home for the elderly who test preliminary positive? May I know the normal duties of this staffer? Does he or she come into contact with elderly frequently? And about the worker at the third runway system site. May I know if there is an outbreak? Are any other staff members sent to the quarantine center? And for the nurse at the North Kwai Chung GOPC, you said she received patients and explained the procedures. Usually, how long did it take? And what about the anti-epidemic measures adopted when she met with the patients? And can you explain the incubation period and why no patient has to be sent to the quarantine center? For the person working at the Lam Wu home for the elderly, this case is a care worker, and this case comes into contact with elderly people. As for the one living in Sham Shui Po, more details will have to be inquired upon. And for the construction worker, there are about 20 other workers who shares the same facility and a resting lounge, and they'll be sent to quarantine. For the nurse you mentioned, she tested positive yesterday on a preliminary basis, and we traced her activities over the past 14 days. Her activities mostly involved explaining procedures to patients. And in doing so, both the nurse and the patients had their mask on, so no patient has been listed as a close contact. I'm sorry, I should correct myself in relation to the negative pressure ward at the Caritas Medical Center. After emergency repair, the wards resumed normal operation at 12:04. That should be the correct time. Next question from TVB. Now we're seeing more and more vertical transmission cases in buildings. Can we say that the risk has escalated? The housing department earlier inspected the drainage and pipes for buildings. Why are we seeing so many such cases? And about evacuating residents, may I know the latest capacity at quarantine centers? And according to experts, if the number of infections continues to go up, we should consider, for example, if you have 3 test results with high CT value, one should be able to be discharged from hospital and stay at home for 7 days. We're now seeing more vertical transmission or horizontal transmission cases. In a densely populated place like Hong Kong, especially in housing estates, this is in fact inevitable. We should pay attention to the U-traps. We understand in some cases the residents never pour water into the U-trap. And if you keep the windows closed and keep the fan on, you could be causing virus to be transmitted via U-traps. Sometimes these units are very close to each other, and because of aerosol, airborne transmission is possible. That accounts for infections in neighboring units on the same floor or the same orientation on different floors. Perhaps if you leave the window open, airborne transmission could take place. So especially for Omicron, it's highly transmissible. As I understand, at the moment we do closely monitor usage of the quarantine centers. I understand at the moment we haven't reached capacity, but in case we see a surge of cases, say a few hundred cases a day, then we may not be able to cope, but at the moment it's still within capacity.
We are discussing with the Department of Health about discharge arrangements. We need to take into account scientific data. That is, for CT value of a certain level, whether we can still culture virus. So we need to work with the Department of Health to see if there is any adjustment needed. I'm from Hong Kong 01. I'd like to ask about a third runway worker. Where does that person live? And where are the person's whereabouts? You talk about sharing the facility in a common lounge, and thereby, that explains the transmission. So for the unlinked cases, where do they live? Where are their whereabouts? And yesterday you mentioned about 2 cross-family gatherings. Any signs that is spreading? Do you have any information about where they live? For the third runway, Sek Lei house in Sek Wing House in Sek Lei Estate Phase 2. Well, they share the same changing room and a common room and certain facilities. As a result, there is transmission. It's very likely given previous cases. Well, for the family gatherings, most of the people involved are confirmed cases. We need to wait and see if there is any sign of further transmission. For unlinked cases, they've been to a number of places. If there is any point of concern, then we will include them in the compulsory testing notices.
From RTHK. So there are residents like from 4 buildings have to evacuate. So what are the risks of vertical and horizontal transmissions in the buildings? And because there are quite a lot of cases being evacuated, so how's the capacity for the quarantine facilities? Are they full now? And if later maybe there will be more transmission happening in some buildings, will these patients be home quarantined later? And for the case of the worker at the third runway, what's the health risk among the workers there? And because you said that they only have to test but not to quarantine. Thank you.
For the workers at the third runway, those who are in the same team, around 20 or so colleagues, they have to be quarantined. But the construction site is very big, involving more than 2,000 people. In different teams working in different nature, so they have to undergo compulsory testing. We do observe that recently, with the starting of the 5th wave, we have quite a number of buildings, more than 10 buildings, that have vertical or horizontal transmission, probably due to the highly infectious Omicron or Delta virus recently. So because of the building nature in Hong Kong, we have high-rising, very crowded building with some sharing pipes or some physical condition that may facilitate the transmission either horizontally or vertically. We try to, once we identify there is possible horizontal or vertical transmission, we'll try to identify those units at risk with other government departments and then move them to the quarantine center to play safe. For the quarantine facilities, we are closely monitoring the situation every day. And of course, we will have some backup facilities and backup options.
Next question. No other questions? That's the end of the press briefing. Thank you.